feel ready to go for this podcast. Obviously, we have a new substitute host today instead of Dan. This is the first one I don't think Dan's been a part of. Yeah. We got Brian Smith here again.
For my almost like fifth or fourth episode, it's not new anymore.
That's true. You're like the
I told
familiar,
Dan that last time too.
The familiar face. I've got my printout of notes here. I feel like a newscaster about to share the nightly news. But Dan's actually in Florida this week. He's at the Valspar golf tournament with WellCare. So we're just kind of filling in. And we've got an episode today that it's on top of our mind that we've been wanting to do for quite a while now. And we want to talk about selling Medicare supplements versus Advantage plans. And this is always kind of a hot topic, and it's been even more of a hot topic, in the past, but we kind of want to put this content out. I think there's a lot of misinformation. I hate that word. There's a lot of opinions, strong opinions one way or the other about, which one's superior. And so we're going to kind of get into it. Just for some context, we here at Agent Boost, we sell plenty of supplements. Brian and I have both written many of both types of plans over the years. Brian still actively writes business. It's been a minute for me, so if I'm a little bit rusty on anything I say, I have Brian here to fix me, to correct me.
Well, you do have, it's not so much an issue when you're meeting with the customer the first time. It's just whatever's best for the customer. It's when you're trying to get a customer to do one thing or another based on their current situation. Yeah,
correct. Selling them. So first of all, when you're meeting with a client for the first time, we always want you to do a needs analysis. And absolutely, a supplement is going to be the right course of action for some consumers, right? And so before any of the supplement fans or supplement only people get out their pitchforks and torches, let's just lay that out there right now, that supplements are still absolutely
very viable,
absolutely the right choice for some people. However, as we've been in the industry I've been in for 15-ish years now, 16 years. Brian's been in 11 years. We've seen a massive cataclysmic shift in the direction of the way that these Medicare plans are delivered. And the majority of folks turning 65 now are going to Advantage plans.
51% of the population can't be wrong.
Correct.
Right.
Well, I mean, and that number's increased to be 51% of the population very quickly because supplements have been around, since the 60s, and we've really seen this, like I said, a massive shift towards Advantage plans over the past couple of years, especially. So a couple things that I wanted to highlight is it's definitely the preferred model of care that that Medicare is going towards. It's how if you are not selling Advantage plans, I frankly don't know how you could make it in this business anymore. Now, another thing that we've seen in the past is there's less requirements to sell a supplement than an Advantage plan. Every year, if you want to sell Advantage plans, of course, you have to pass AHIP. If you want to sell any MAP, any Advantage plans or any prescription drug plans. And what we found, especially in the past, is many agents never wanted to do those certifications. They didn't want to go through AHIP. They didn't want to certify with each carrier. Maybe they were PNC agents only or diverse agents, and it was easier for them to only sell supplements. And there was also many call centers, many agents that were supplement only warriors for many years, right?
Yep.
We've seen many of those people that are very loud in the industry now that used to be on that side of things, that used to be on that team, and they spoke very loudly and frequently about it, and they've come to really change their tune, especially over the past 3 or 4 years.
Well, it's also been kind of a huge shift in the actual viable companies you sell in the MedSup world, right? It used to be every Tom, Dick, and Harry was jumping into the MedSup game.
Correct.
Just to get their piece of the pie, right? Mm-hmm. And I've kind of come to the realization that if you're going to sell a supplement, make sure you sell one that's with a company that's healthcare based, not life insurance based, like your one-off carriers that are just trying to get into this market.
Yeah.
They will experience a cost change moreover than anybody else.
Well, and we've kind of seen the industry clean out a lot of those smaller fly-by-night carriers, and it's even on the supplement side, it's really kind of centralized to be mostly healthcare-based products. The other, insurance type, jack of all trades insurers haven't fared well over the past 7 or 8 years with supplements. And before we get into this, because what we really want to talk about is why the industry has gone towards this Medicare Advantage model, the benefits, and I want to talk about some myths versus realities of supplements versus Advantage plans in a way that helps agents, because we have a lot of agents that sell, they're trying to convert people that are on a supplement, convert them to an Advantage plan for better or for worse. Well, it's always for better, right? Like, we're never going to harm anybody, but there's a lot of people that are very, very resistant to switching off a supplement to an Advantage plan. So I want to talk about, kind of our perception, our tactics in a way that helps agents, if you're talking to a client or a prospective client, if it makes sense, if and when it makes sense to benefit that client, how to break that mindset of I've got to be on a supplement only. Right?
Well, the mindset of insurance-based anything, right, is pay now to be covered later.
Correct.
That's where a lot of these MedSup only agents are coming from.
Yeah.
If I'm selling insurance, I'm going to sell it insurance, which is the pay now model.
Yeah.
And they just haven't really been baptized into the Medicare Advantage space yet.
Yeah, so there's a couple of things that I want to reference to set the table before we get into some of these myths versus reality. And the first thing is, in 2021, Milliman Actuarial actually came out with I believe it was commissioned by United Healthcare. I'll try to drop this link in the chat below, in the description below the video, a link to this study. But there was Milliman is the premier actuarial firm in the country, and they did an analysis for United Healthcare that showed, as a result, that somebody on a Plan G supplement will end up spending almost twice as much throughout the course of their years on Medicare as somebody on an average Advantage plan. Okay, so that's pretty hard evidence that if you're just talking masses, if you're just talking statistics and numbers, that individuals who are on an Advantage plan in general, long term, are going to save half as much, or going to pay half as much as people on a sub.
Right. And I posted that link in the Facebook group, and I got lit up for it. Can you please share your source and where you got this from? And of course I did, and it quieted everybody out.
Yeah, it's
Milliman's very, very reputable.
Yeah, and this study, we'll link the PDF or the actual study. It was done over multiple years. It had all the, the best actuarial data. It's all source referenced. It's very cut and dry, very clear. And it's a pretty, if you're a supplement only or a standard bearer for only supplements, it's a pretty damning study, because it does show that costs have just become so out of control in general on those supplements that a lot of times, people will compare a bad year on an Advantage plan, and they're not comparing it on a multi-year basis, apples to apples comparison.
Well, speaking about actuarial firms, you've heard Talos, right?
Talos, yeah.
Talos Actuarial.
Jared Strzok, he works for them, right?
Yeah, I don't know. They just released something that said by 2032, there will be a 3 million person increase into the Medicare supplement world. Right now, there's about 14 million members on Medicare supplement, and that the three biggest states with the most MedSup members are California for one, Texas, and Florida. They have the most Medicare supplement members in the nation.
Well, they have the most humans there,
Correct.
So that makes sense.
But by 2032, that's a long way away, and only a 3 million swing when we've got 10,000 people turning 65 every day.
I would be willing to bet money that they don't increase that even by then. I think that we continue to go the other way and continue to proliferate Medicare Advantage, and I do foresee the days when supplements just probably don't make sense years from now for most people. And so let's kind of get into that. The other thing that I want to talk about is things changed massively for supplements post MACRA. Now, MACRA was legislation that passed, I believe, in 2015 during the Obama administration, and it really revolutionized the care model and the compensation model for many of these plans. And, we had notes to talk about value-based care and care models and compensation metrics. And it's hard to talk about these things for most agents without their eyes glazing over and they just go, man, this is the most boring stuff that we could ever talk about. But it's critically important, right? And MACRA really changed the way that carriers were compensated, and it changed the MOC, the model of care. And we talked a lot about these models of care with our Optum podcast with Dr. Nguyen and Scott. We talked a little bit about how doctors work in those models, and Optum obviously is a value-based care model. So again, just to give you guys some education so you're all smarter agents, original Medicare functions billing how, Brian? What's that contract type?
Fee for service.
Fee for service, okay? So the way that works, just as a reminder, is Medicare has a fee model, a reimbursement schedule. There's a CPT or a billing code and, that doctors provide, and then there's a corresponding fee schedule or reimbursement rate that they get compensated, right? So you go in, you got a wart removed, you know, your doctor bills that code, CPT 10697B, that's a non-malignant wart, whatever. This isn't right, guys? I'm just making this up. Yeah. Sends that bill, and then they get reimbursed $137.62, right? So if you're a doctor on a fee-for-service model, like we talked about, how do you make more money?
See more patients.
You see more people, and you churn and burn, right? And you go in and you get you send those fees and you reimburse. Now, does Medicare and Medicaid pay or reimburse those doctors as much as private insurance? No. Right? So generally it's about, I think it's like 66, 67% on the dollar to what, you know, traditional private insurance pays or reimburses.
It's a very unattractive contract at face value.
Correct. So very unattractive contract to doctors. So now if you're on a supplement, that same CPT code, that same reimbursement rate, you're going to get a little bit of extra, a little bit of bonus money on top of that. So the doctors get the fee, they bill original Medicare, they bill your supplement, and they get an extra 10 or 11 or 12% roughly on top of that. So now my $137 that I got for removing Brian's wart, I get $137 from Medicare, paid at some point way down the road, and then the insurance company, let's say he's on a United Healthcare supplement, they issue me their check for an extra $15, $16.
What was very eye-opening, I used to do a lot of, lunch and learn events with different provider offices and just kind of trying to work with them, teaching them how Medicare works. And it was, first of all, eye-opening that they really didn't know anything about Medicare. All they knew is how to bill it, right? Mm-hmm. And the provider, I was doing a Medicare 101 with his team, the billing specialist, the front desk person, all them. The provider actually jumped in because he was interested, and then he showed me a picture of a Porsche. He's like, hey, this is the car I'm going to buy. That's my Taurus out there in the parking lot, and I know exactly how many people I need to see to own this Porsche. And I was like, well, how many is that? Well, it'll take me a few years, but I know exactly how many people I need to see. And
so he broke it down for his average dollar amount fee for service? The
average ailment that each senior comes in with, or anybody really, but he was not on value-based care. Uh-huh. It was definitely a fee-for-service model, and he didn't realize the benefits of this value-based care model.
Yeah. So guys, to that value-based care, that managed care model, and again, we've talked a little bit about it before on podcasts, but MACRA, that legislation introduced and wanted to change this model of fee for service because, again, that's not necessarily delivering quality of care. That's delivering speed and churn and burn. And that doctor is not compensated to be thorough. That doctor is not compensated to spend extra time with that individual. That doctor's compensated to see something really quick, get it through. And that's why, a lot of times we've gone to the doctor and, the assistant's in there or the whatever takes your blood pressure. The doctor runs in real quick with this board. What do you got going on? He's in and out of there like a flash, right? They're trying to see all those people as quickly as possible. Well, MACRA changed for a lot of these government Medicare and Medicaid type plans to a more managed based care model. And the concept of that, you guys should all go read MACRA legislation, watch videos on it. That's MACRA. And
most agents think of that as the removal of Plan F.
yes, that was a part of it, right? Plan F as supplements went away because that Plan Fs were people on Plan Fs were identified as the highest utilizers and abusers of the healthcare system because, Plan F was 100% coverage in addition to Medicare, and Mima goes and gets a cold. What does she do? She runs down to the ER
every time,
or because she knows she has there's no barrier of entry, there's no compensation or out-of-pocket cost.
Overutilization.
Yep. So it was a massive amount of overutilization. So the government changed that, eliminated Plan F for anybody going forward, anybody aging into 65 after that. And that's what most agents know of MACR. Well, it actually changed the industry much deeper and more complex than that.
Right.
And that was in the introduction of these value-based care models. And essentially the concept is, hey, Brian, I'd rather have you be outcome, and this is the key word, guys, is it should be outcome-based, not fee-for-service-based. And so what is the outcome that I'm trying to get? If I'm Brian's primary care doctor, I want to do a good, thorough job. I want to make sure he comes in and gets all of his preventive care done. I want to make sure that all of his vitals are set within the range that we're trying to monitor. And I would rather be compensated to spend more time to deliver value-based care for him, knowing that in the future down the road, I'm going to get a better outcome. If I can manage his diabetes, if I can manage his, sorry to keep using, I know you don't have any of these, his high blood pressure, then long-term, he's going to be healthier. He's not going to need a heart surgery down the road. It's going to drive down utilization. And in a perfect world, guys, that's what Medicare Advantage plans have actually done, is when they are functioning properly in these value-based care models, these coordinated care models, it is driving healthcare costs down. It is delivering a MOC, a model of care that is superior in that many of these insurers, they get demonized a lot of times, but with this MACR legislation, whether they're doing it altruistically or because they want to be compensated better, they have changed the way that the care models are delivered, and it's getting people better healthcare overall. That we're experiencing better health outcomes in a lot of these circumstances.
It's much more improved patient satisfaction as well, because they're delivering upon not only what they've come in to see the doctor for, but anything else that may be underlying at the same time.
Correct.
They're also having more trust in their providers, which is going to lead to, a better coordination of care. They're going to allow that primary care doctor to refer a specialist to them for certain services, even though maybe their Medicare Advantage plan does not require a referral. They're going to be more apt to accept that referral because of their trust in their original doctor. Correct.
And it's more, if you think about it, with networks and advantage plans, it's more about controlling the experience, controlling the ecosystem in the environment, and making sure that the care model is delivered where the left hand knows what the right hand is doing. That, for example, somebody out on a supplement could go to this doctor and that doctor and that doctor and that doctor, and they all accept original Medicare, but then there's no coordination of care,
no continuity of care.
They're looking, this doctor has this person on that. They go to their other specialist, and that doctor puts them on a potentially medication with adverse effects or things like that. They're trying to making sure that the primary care doctor acts like the quarterback of their healthcare and kind of make sure that they know what's going on in that person's health life, basically. So the other thing that MACR was meant to do was help identify and treat some of these social determinants of health as well, and kind of be able, so any dual SNP plans, any D-SNP plans out there, any LIS, all of those are delivered through the Medicare Advantage mechanism. And that is an ever-growing, ever-important piece of the pie in the demographics. And if you're just ignoring that demographic, it's much to your detriment, because there's some states where 50% of seniors are on Medicaid, or they're below the poverty level and they qualify for those plans.
Yeah.
So, if you're not versed on those demographics and that care model, you're not going to be able to help as much of the population. You're limiting your own ability as an agent. All right. So I want to talk about, we've kind of set the table for, the landscape of why things have been shifting to Advantage plans, but still, I believe there's a lot of myths out there or bad, and it usually comes from agents or agencies that are very, very pro supplements.
Right.
And I want to just go over these again. Let me just say this into the camera. So all you agents that want to come and got me on this, this is not a be all end all. This is not every case. Each circumstance is different, but in general, there are some myths that I want to talk about, that I want to tell you as a rep, how I have switched people over. And I will just tell you this, that I have personally switched probably 500 people from a supplement to an Advantage plan. And only one time ever in my career has somebody called me back and said, that didn't work out for me. I want to go, I used their trial right and put them back on a supplement. And it was mostly more just a feeling of preference and stable, predictable costs versus anything else. One time, one person out of 500. Every other person I've never heard back. How about you? I mean,
about the same. I had one issue where I put him right back on a supplement a month later, only because of a cancer diagnosis.
Actually, I got to correct myself. 2. One of them was a family member, my wife's uncle. And again, that was kind of recent, and that was just purely a matter of he has cancer, and we mathed it all out, but he just wanted to feel like he knew his stable, predictable costs.
I kind of forced my mom as well. I put my mom on a supplement ever since she's been 65. She was kind of prone to hospital stays and weird things happen in her health until that iSNP came out.
Yeah.
And I forced her onto the
That's
iSNP.
a killer. That iSNP killer is a supplement killer where it's available for sure.
So just to give you an idea, my mom her supplement, she's 72 right now, so she's been on her supplement for 7 years. I moved her to this iSNP with a $1,300 max out of pocket. She's paying $260 a month for her supplement. So just her supplement. And we all know what's happening in the PDP space, right? The private or prescription drug plans they're getting a big hit, right? Not necessarily on the Medicare Advantage with PDP side, but standalone PDPs are taking a big hit right now. And their prices are going to increase, and it's going to affect MA plans a little bit, but it's going to affect people with supplements even more.
Yeah.
And so my mom was paying that. She had a $65 drug plan, which, just based on her drugs, that was the best option. And I moved her to this iSNP, and she is saving thousands.
Yeah. I just moved a 90-year-old lady this past AEP because she was paying $542 a month all in, and the max out of pocket on the iSNP was $1,300. She loves me.
And this is going to probably trigger one of your myths, right?
Yeah.
So back to my mom. Her biggest trigger was, I never pay anything for anything.
Yeah.
I had a surgery last month, and I didn't pay a dime for it. And you have to bring out the paper napkin. You got to.
Well, yeah, we'll go over that in depth.
And that's a great one.
And for sure, I actually had my father when he aged in. We put him on a supplement too, under the same thought. And that very next year, they were like, "Why are we paying all this money?" Because I thought he would be a high risk, and he ended up going to the doctor 2 or 3 times, and we mathed it out, and he would have saved a couple $1,000 just that first year. So he's back on an Advantage plan. Myth number 1, right? And before we get into this one last time, I do want to say that all things are not equal, right? All states are not equal. Correct. All carriers are not equal. Situations are different. Here we're based in Utah, where Advantage plans, we have great plans, great providers, and networks are amazing.
Yeah.
Basically, 4 out of the 5 major carriers here, you can pretty much see any hospital you want, and almost any doctor worth their salt is going to be included.
And those plans that you're mentioning have national HMO or PPO networks.
Correct. So, and that is different across the states. We sell in all 50 states. We have agents in all 50 states. And so again, if you're out there going, well, it's not like that in my particular county, I hear you. We're talking generalizations, right? So myth number 1 that I hear all the time is, well, don't you want to have access to doctors and facilities? And there's this idea out there that you have superior access because you don't have a network, it's not an HMO or it's not a PPO, and that was one thing that proponents of supplements only would basically say is, well, don't you want to see the best doctors? Well, don't you want to see the best facilities? Because you can go anywhere with a supplement. And the reality is that's not true, right? There's a lot, depending on where you're at in the country, access to care is a major issue, right? And you might find doctors that don't want to accept original Medicare or fee-for-service because they want to get compensated on this different model of care, and so you've seen access to care becoming an issue post-COVID. There's less doctors. People just want to get seen a lot of times, right?
I've seen doctors drop out of accepting Medicare strictly because that population is the one who seeks care the most, and they don't want to be inundated with just seniors.
Correct. And so that is not always true, right? And there's a lot of high-end facilities of like, a lot of agents for years would sell it as, well, if you have a chronic illness or you need to go see a specialist, you want to go see the best of the best. You want to go out to Dr. House out in California, and have him be able to diagnose your rare condition and get the best care. Well, we know that's absolutely not feasible or not true, or the access doesn't determine that. And there's a lot of facilities across the country that may have a contract, a value-based care, a full risk contract with some of these providers through Advantage Plan, but you're not going to be able to get in the door through a supplement, right? So,
well, and a lot of these high-end clinics and hospitals across America, we're talking Mayo Clinic, Cleveland Clinic, MD
Correct.
Anderson, Advent Health Orlando.
Linda Loma, yep.
Yeah, they're all starting to accept Medicare Advantage.
Because of these networks, these contract rates, they want to get paid more than what they get. And if these doctors in these facilities and these clinics, guys, if they take the fee-for-service reimbursement rate and what the supplement's going to reimburse on top of that, it's still not anywhere close to what these full risk and these managed care compensation models are paying these providers. So that is I don't want to say it's a truth, but it's definitely not as cut and dry as a lot of supplement sellers want to put out there. Again, consult your clients, check their doctors, check their networks, fully explain these things to them, and let's work on reality, right? The way my mind views it is supplements are very reactive care. If you go to the doctor, it's going to get paid, it's going to get reimbursed, and Advantage Plans are more proactive care because of that managed care model. To that point right there, I'll tell a lot of my clients, I say, hey, for example, my father, he's probably a guy that if it wasn't for my mom would not go to the doctor. He would not, until all of a sudden we turn out, oh, you've got this tumor on your back, Dad, that is the size of a grapefruit. Why didn't you go into the doctor? But the plan that he's on right now is a United Healthcare Advantage plan, and they have that compensation model where they need to get him in. They need to go, make sure that he's going in for his preventive care, his screenings, he's getting his PSA done, and the doctor is managing his care. And because they're doing their checkpoints so they can get compensated at those higher rates, and that care model is working, right? So myth number one, access to care and doctors is superior on a supplement. Could be true, could be false, depending on
where you live,
North Dakota, and what you're trying to go to, okay?
South Dakota, areas like that.
Yeah, I mean, access to care in Wyoming is hard no matter where you're at. You just got to find a human being doctor that, is where in a 300-mile radius of where you're at.
And that brings up a good point, too, is when MA plans you mentioned Wyoming, there was a big influx of MA plans being released in Wyoming this past open enrollment, and there's always that little hump to get over as far as access to care and doctors being in network. They just don't understand the contract.
Yep. And eventually,
they've never had
the hospital systems and the networks and the provider groups and the ACAs and the IPAs and the ACOs are all going to focus on where's our money, who has our contract, what provider, what carrier are we getting compensated the most. That's who we're going to treat as our VIP premier clients. Those are going to have better access to care than somebody who's not on one of those plans.
When you see a provider finally realize that they get a PMPM
per month
payment,
compensation
right,
model
on their whole panel,
yep,
the members they see, right?
That's the guy's Porsche payment now.
There you go.
His PMPM on his book.
It's much more attractive to get that kind of contract, that PMPM, rather than waiting for someone to get sick.
Correct. So let's talk about myth number 2, right? On supplements versus advantage. Travel, right? Well, you want to travel, don't you? Mm-hmm. And so when people are like, well, I ask my clients, well, why are you on that supplement? Why are you paying that amount? And a lot of times they're like, well, I travel. And I say, okay, when you say you travel, what do you mean? Are you living in an RV and you're like going from campground to campground, or you have
a home,
or you have houses in multiple states that you see doctors in multiple states and multiple networks? And they're like, no, I just go on vacation. For whatever reason, it became a thing where supplement sellers really pushed this travel access because it was a, doctor-based exception of Medicare, that if you wanted to travel, you needed to be on a supplement. And a lot of seniors travel, but most of them are not necessarily snowbirds, or they're spending time in multiple states, or they're even seeing doctors outside of their resident state. So I say, when you say travel, what do you mean? Are you like a international or a national vagabond, campsite to campsite, and have multiple homes in multiple states and see doctors all across the country? Or you just go on vacation? And almost always they're like, oh, I just go on vacation. And I say, all right, well, that's a common misconception, because, on an advantage plan, you actually have what? Worldwide urgent and emergency care coverage. Okay. It is a requirement for all of these advantage plan carriers to give you worldwide urgent and emergency care coverage. So if you're talking about a supplement, let's talk international. International coverage, there's no coverage on original Medicare, doesn't cover people outside of the U.S. and U.S. territories. But most of them will have a $50,000 lifetime max on a Plan G. Well, I mean, we know if you have an international health incident, emergency, you're probably going to rack up $50,000 worth of costs pretty easy. Yeah. On an advantage plan, you have worldwide lifetime urgent and emergency care coverage, okay? And so that is what most people want. They want that. If I'm out vacationing and I have to go to the doctor for some reason, I want to know that I'm going to be able to go to the doctor and not have to pay out of pocket on that. And what is the determinant on if it is urgent or emergency care for someone, B?
Life or limb.
Life or limb. And it's generally left up to the Medicare beneficiary to decide for themselves if they feel like it was urgent or emergent care, if they needed to get that.
So breaks down to that CPT code.
So, CPT code. And I go to my clients, I'm like, so you're going to have just as good or possibly better coverage traveling on an advantage plan than you were on a supplement. Now, there may be people who, I have a couple clients who they live in Montana and they're there when it's warm, and then they go down to Arizona in the cold. And they were on a supplement and it worked for them, but it started creeping up in cost. Now I've have them on a Humana regional PPO where they can see doctors on both when they're 3 or 4 months split between, and that works out great for them.
Now, it is up to the agent to do their due diligence in that full needs analysis to make sure that if they do have that second home, and if it is more of a travel, less of a travel, more of a stay, right? Travel, I would say a week to 2 weeks at a time, right? Mm-hmm. A stay would be up to 6 months at any given time. So it's up to the agent to do that full needs analysis to make sure the doctors that they want to see will be in the network.
Correct. And then, but a lot of advantage plans, for example, United Healthcare has their passport program. They still have that?
Nope, that's gone.
Strike that from the record. HMO-POS. But it basically functions like that, right? I was just thinking that used to be one of my go-to.
That was kind of a nightmare, actually.
It was, you had to call and activate the network.
Sorry, UHC. We didn't like it.
Yeah. So sometimes that's an perfect example. I'm a little rusty on some things. Didn't know they'd eliminate. But the HMO, POS, and the PPOs make sense because that functions better and easier, and they're already contracted. So the next thing that I hear all the time is that agents have coached their clients on is, what if I get cancer? What if you get cancer? Or what if you get this or some chronic condition? And they scare them like, well, if you get cancer, it's going to bankrupt you, and you're going to not be able to see the doctors that you need to, and you're going to be left with discount coverage when you need it most. That's probably the most prevalent scare tactic is, what if you get illness. Cancer, you know? So what's your experience been with clients who have had cancer or a serious chronic illness on an Advantage plan?
Well, first of all, we want to talk about the maximum out-of-pocket scenario on Medicare Advantage plans.
Do you know what the average max is? I pulled it for 2024.
Is it around 6,000?
$4,800.
$4,800. Wow,
the average MOOP across the country now on an Advantage plan is $4,800.
And that's been kind of a roller coaster as well.
Yeah.
And why? Because that's kind of where they can shift cost around, because they know less than 2-3% of people nationwide hit their MOOP.
Yeah, it's around. Yeah, I've heard 5 to 7%, whatever, but it's less than 10%.
Not a whole lot. Mm-hmm. So the cancer aspect is, you know, more so being able to understand how to get that care and what their max out of pocket is.
Correct. Well, people just know that coverage like that is expensive, right? And they think that it's going to potentially bankrupt them. And even a max out of pocket sometimes on an Advantage plan scares people. But really, when you start mathing it out, I'm going to give you a perfect example of a guy that I had. He moved from California. He was on a supplement plan F. He was paying $220 a month for his F. He was only like 70 maybe. And then he was paying for a drug plan that was about $40 a month. So all in, he was about $260 a month. You start, doing the math on it. He's close to, $4,000-ish a month on that. Well, I put him on, when he moved out here, he's like, I want to get on something cheaper with dental. I put him on an Advantage plan that had really good dental as well. And sure enough, he got cancer 3 months later. And he started having these co-payments. He was going through chemotherapy. He was going through all of it, right? Surgeries, lost his teeth through the chemo, everything. And they just kept calling me like, hey, we're getting these co-payments. We're getting this. And we got to do something, right? Like this is bad for us financially. So I'm like, hey, well, we can use your trial right. And I can put you right back on that supplement plan F. So we sat down, we met him, and we started going through the numbers and doing the math on it. And when they added up in their mind what they thought were all these co-payments, they ended up spending about $3,800 throughout the year on their co-payments. Yeah. In addition to that, we started factoring in the medications, and the medications were cheaper and better on this Advantage plan than they were on his prior standalone drug coverage, which is always the case.
Better contracts.
And then he had dental. He had $2,000 worth of dental that he'd used to fix and replace some of his teeth that he was having issues with through the chemo. So when we mathed it out, even in this, what they thought was very catastrophic, he still was coming out ahead $1,000 or $1,500. And they were like, you know what? We don't want to go back to that supplement, because even in that worst case scenario, they had still saved costs and they'd had additional benefits like the dental. He'd got help with his vision and all those other things, and we kept him on the Advantage plan.
Yeah, even if you kind of put it on paper and calculate it out, someone's full premium for the year on a supplement plan versus a max out of pocket on a Medicare Advantage, there may depend on their age and what they're paying, right? But generally, it's going to be lower than the max out of pocket on an Advantage plan, because that usually never happens. But then you have to factor in, like you said, the cost of anything additional they have, any ancillary products, the dental,
correct,
vision, any hearing, any other thing they may have. But generally, you can whittle that down to equal or greater than the MOOP on an Advantage plan, which they'll never hit anyway.
Correct. And back to my example, a lot of people think that, for example, chemotherapy is going to be this multi-$1,000 copayment every time, and that there's, it's not. When you do the CP, when you go pay the Medicare, the Part B premium, it's usually that 20% amount, or a lot of times it's a fixed dollar amount. It's not near as much on a copayment per instance as people think. And so for a lot of these chronic conditions, even when people are accessing care fairly frequently, a lot of times they're still better off on an Advantage plan, so that what if I get this scary chronic condition usually doesn't apply. And again, like we've talked about with some of these other facilities, a lot of times you have great access to doctors depending on where you live, because they're getting these reimbursement rates, their contract with these plans, and their access to care is great. So again, it's all situational. These are things to know, to just talk through with your clients, okay? So the other thing that, the myth versus like what you were talking about is, well, I pay nothing for and that was especially on people with a Plan F. They'll say that to you all the time. Well, I don't pay anything when I go to the doctor right now. And I'm like, well, you pay $350 a month, so you don't have to pay anything if and when you go to the doctor.
For the past 6 years, right?
Yeah, for the past 6 years. And so that's another thing is people want, on supplements, a lot of times people will want stable, predictable costs, and they're willing to trade that off in their mind for potential savings, right? And that's a legitimate reason for a lot of people. But a lot of times, so I'll tell you what I do with this exercise, is like Brian said, I have a spreadsheet. I'm not going to link it. It's not compliant to give to people. Basically, it's an estimator that I've built that shows all their costs of what they're currently paying. And then what they would have paid on an Advantage plan that I'm proposing for them. And so what I'll do is I'll say, okay, you're on a supplement Plan F, you're paying $230 a month. I put that in there right there and times it out through the year. What's the math on that? Like $3,000-ish, $2,800. And then I add, what's the next line item is, what's their drug plan on there? How much does that cost? And then I'll ask them, what did you pay on your meds, or what? And I'll even go into Sunfire and I'll look up what their current meds are on their current plan. And I'm like, shows me this is your drug cost on this plan right here. And then I'll say, did you pay for any dental insurance? Did you pay for this? And then it sums it up at the bottom, and it's generally multi-thousands of dollars. Yeah. And if it's a husband and wife, it's even more powerful a lot of times because they're paying thousands. I've seen people paying over $10,000 a year as a couple.
Well, personally, I don't dislike med sups. Mm-hmm. I sell them when it's appropriate, but every time when I've done a T65 appointment, right, I do a grid, good, better, best, right? Mm-hmm. The best is obviously going to be med sup, but it's also the most comprehensive and the most expensive. And, it breaks out that way when you put it on paper. And then when I come to Advantage plans, I try to explain the Advantage plan. I always say, let's pull out a piece of paper. I want you to go through with me what you think a horrible year of healthcare would be. And if they don't really know, like, oh, I don't know. How about this? How about a specialist every month? How about a doctor visit every month as well? How about, 2-3 night stays in the hospital, 3 ER visits, a life flight ride, an ER visit? Does that sound like a typical year for you? Well, no, it's never happened to me, right? Never happened to anybody, really. And then I take that.
What happens to some people?
Yeah, it can. But so I take that scenario and I add up all the copays that an Advantage plan would be out of pocket, and it's always less than the 12-month premium.
Exactly. So what I do is I take that column, I sum up all their costs on a supplement of what they actually are paying, and then I go over on the Advantage plan. I'm like, okay, usually 0 premium plan. I'll add their meds in and I'll recalculate it on that Advantage plan just in Sunfire, and always it's less money because a built-in Advantage plan, drug plan, the contract rates are better, the costs are lower, saving them money on their drugs. And then I'll say, okay, now how many times did you go to the doctor this year? And we'll start adding it. I went to the specialist X amount of times. And sometimes it's like no money out of pocket, or very little co-payments. And sometimes, like Brian said, even if they've accessed care a lot, you add those co-payments up and it's generally much less money. And so I say, had I had you on this Advantage plan, you would have paid X amount of dollars. Let's say it's $800. Instead, you paid $4,782 out of pocket. Not only that, in addition to that, if I had you on this Advantage plan, you would have got this, and this, and all the other ancillary benefits that a supplement doesn't have: the dental, the vision, the hearing, the over-the-counter, any other, ancillary benefit. And I say, so, knowing this, why would, what is your driver to stay on that plan? And if I break it down for them like that, and I've already explained to them what we talked about earlier in the podcast and how these things work, they're generally like, oh yeah, like it breaks the spell, right? Like, why am I on that?
And you can see their mind start working in the back of their head there. You can see it in their eyes, like, I could save $200 a month.
Correct. What I do to drive that home is I say, so take that $470 a month that you're paying right now and set that in a savings account every month. And then pay your
Now this is going to be a plug for MedSups, right?
Pay, huh? No, and then I tell them, pay your co-payments out of that saving account, and at the end of the year, you'll know exactly how much money you saved.
Honestly, I've yet to have a customer that's been able to do that.
Well, no one did. Like, they like the idea of it, right? Like, you tell them, if you would have saved that $3,000, what would you do with that? You know, and they're like, oh, I'd go on my trip to Europe. You know,
I'll use that for co-pays. Yeah, that rarely happens.
Now, I'm not going to make sure they manage their finances.
Right.
I mean, but what I'm saying overall is that it breaks that spell of them. And there are, like I said, there are legitimate reasons why people should and stay on supplements, right? Like we run across people all the time, but a lot of times it's just they don't understand, or they've been coached or told by an agent, like those dirty Med Advantage salespeople, they're just always trying to trick you onto a worse product. And really, when you sit down and talk to most people and you take the time to explain it like how we just did, a lot of times people will see that cost analysis and they'll be like, that's too good to be true. Like, how can I get on an Advantage plan that's $0 and that's going to be my end result? Now that is a topic for a different podcast that I think we should go over, which is how Advantage plans are funded, how we explain how it's not too good to be true, and how to position those, right? Yeah. So,
well, I can't tell you how many times that I think it's a shady practice myself. They can't really do it for MA because of compliance, but with MedSup, there's very little compliance. You can go door to door if you want with MedSup. You can, a
lot of people, our competitors, still go door to door for MedSup, and then they get a scope of appointment.
Yeah. But it's every time, like I said, I can't tell you how many times that I go to someone who's turning 65 and they don't know that they've already been signed up for AARP Medicare supplement.
Yeah.
Because they get something in the mail that says, sign this today and you'll have AARP. Like, oh, I guess I'm retiring. I do need AARP. They sign it and they've automatically enrolled in a supplement.
Yep. So again, let's bring this home, guys. Like, hopefully this helps you understand, like, in order for you to sell or convert people from a supplement to Advantage plan, number one, make sure that it actually is a good idea for the person, that it's actually right for the client, that they can save money, that there are benefits. And then number two, make sure that you go through and you're able to kind of explain things in a way that makes sense. You've got to understand the industry and be able to talk about why, like, how they're funded, why these plans are potentially better, because a lot of you have a broken mindset about Advantage plans versus supplements. A lot of you have this mindset that supplements are preferred, supplements are better, supplements are for people with money, and only stupid poor people get Advantage plans. And so a lot of, right?
Yeah,
I mean, and a lot of agents have kind of like instill that into their clients, like, well, you've got money, so you can get the good coverage. Leave that other Medicare Advantage stuff to the stupid poor people, And that's a complete misnomer. I've put multi-millionaires on Advantage plans when they understand it. If you present the information and do a good job as an agent, people didn't become wealthy by being stupid with their money.
I'll tell you what's doing a good job as an agent is I can take someone on a Medicare Advantage and I could eliminate their highest cost value on that Advantage plan, the hospital stays, right? Mm-hmm. And I can even eliminate their worst case fear of cancer simply with ancillary products.
Yep.
Which you can bundle cancer, heart, and stroke and a hospital.
You're wading into a whole other topic that we'll have to get into, but yeah.
But still less than a supplement cost.
Yep. Absolutely. Well, we gotta wrap. We're up against the hard stop here today, but hopefully some of you may need to listen to this multiple times and digest it. But hopefully this was valuable information. And again, don't come after us, you supplement pro people. Don't come after us with the pitchforks and torches. I'm only just explaining the other side of the house on that too. I know there's a whole counter sales practice and things like that.
But I do welcome all the calls, all the information, emails. Send them to me. I'll answer them with.
And we sell a lot of Advantage plans. Let's just put it that way.
I'm happy to help.
Yep. Thanks, guys.